Hey, welcome and thank you for joining. My name is Trixie Thibodeau, Health Educator for Community Health at Atlantic Health System. Today's webinar, ABCs of Diabetes, and being presented by Ashley Lusick. But before we begin, I have a few announcements. All participants are muted. Please use the Q&A button for questions or the chat button for comments. We'll try to get through all the questions at the end of the program. Are you or a loved one interested in smoking cessation? Atlantic Health offers a free quit smoking program. This program includes an individual assessment, free nicotine replacement products, and a 6-weekly group meeting to help you quit and stay smoke-free. There are multiple dates and times available, with groups available in person or virtually. For more information about these groups and other resources, or for additional dates and times, you can give us a call at 1-844-472-8499, option 3. Now I'm going to turn it over to Ashley. Thank you so much, Ashley, for doing this very important program today.
Thank you so much, Trixie. Hello, everybody. My name is Ashley Lusick. I'm a health educator with Community Health at Atlantic Health System. A brief disclaimer before we begin today. The content of this presentation is intended to provide basic knowledge to help increase awareness of available resources. It is not intended to replace the medical advice from your care team. If you have specific questions related to your personal health and wellness, it is recommended that you reach out to your primary healthcare provider who can review your personal health history and tailor recommendations to you. Before we get started, I wanted to share with you some knowledge that I hope you will gain from attending today's program. I hope that you will be able to list at least 3 parts of the body impacted by diabetes. Recall 2 ways diabetes can be managed. Identify at least 4 of the letters and what they stand for in diabetes management. And state 2 recommended screenings for exams for those diagnosed with diabetes. I also want to take a moment to remind everyone again that today's program is not intended to replace the medical advice of your care team, and we will not be discussing diagnosis of diabetes. All right, so to start off, let's do a quick refresh on what is diabetes. Diabetes is a chronic condition that affects how your body uses food and glucose. Food that you eat is broken down into glucose in the gut, and that is used to provide energy to our bodies. The pancreas releases insulin in response to this glucose and acts like a key to help the glucose enter our cells. With diabetes, insulin is either not produced, not enough is produced, or is not used properly. When this happens, the sugar and glucose can't enter the cells to be used as energy. And what ends up happening is we end up having a much higher level in the bloodstream due to this. Over time, this can lead to serious health problems, such as heart disease, vision loss, and kidney disease. We'll be discussing some of these complications and how to prevent them later in this program. So now that we know a little bit about what diabetes is, there are 3 main types of diabetes that you may have heard about. In type 1 diabetes, the body does not produce insulin. Type 1 is thought to be caused by an autoimmune response. That's where the body attacks itself by mistake. Type 1 diabetes makes up about 5 to 10% of cases, and symptoms develop rather quickly in that type. It's more often diagnosed in children, teens, and young adults, and those with type 1 diabetes will need to take insulin every day to survive. Currently, no one knows how to prevent type 1. Risk factors that we know of are family history, so having a parent, sibling with type 1. In type 2 diabetes, which is the most common form, your body doesn't use insulin properly or doesn't produce enough. And this accounts for about 90 to 95% of diabetes diagnosis. It's typically diagnosed in adults, but can occur in children and teens as well. And this, again, develops over time, and some people may or may not report having symptoms prior to their diagnosis. While some people can control their blood sugar levels with healthy eating and exercise, others may need medication or insulin to help manage it. Regardless, you have options, and we're here with tools, resources, and support that you need. Type 2 diabetes can be prevented or delayed with healthy lifestyle changes and modifications, such as healthy eating and being active. And finally, for those who have ever been pregnant, may have heard of gestational diabetes, which is diabetes that develops during pregnancy in people who didn't already have diabetes. 2 to 10% of pregnancies in the US will be affected by gestational diabetes, and it typically doesn't have symptoms. During pregnancy, the body makes more hormones and goes through other changes, such as weight gain, which can lead to insulin resistance. especially in later pregnancy. Many people that report their blood sugar return to normal after their pregnancy. However, it does increase your risk of developing type 2 diabetes in later life. About 50% of people with gestational diabetes will go on to develop type 2. Lastly, some of you may have heard the term prediabetes. When it comes to prediabetes, the blood sugar and glucose levels are higher than normal, but not high enough to be diagnosed as type 2 diabetes. 1 in 3 American adults have prediabetes, and more than 80% don't know that they have it. So you could have it and not know it, but before people develop type 2 diabetes, they almost always have prediabetes. So it's important to talk with your doctor about getting your blood sugar tested if you have any risk factors. While there is no cure for diabetes, that doesn't stop you from living a healthy life. You can manage this condition to reduce the risk of developing complications. Diabetes management includes being physically active and eating a healthy, balanced diet, taking medications if prescribed, and monitoring your blood sugar regularly. This management also includes remembering the ABCs and more of diabetes. And we're going to talk more about that now. So when I say ABCs and more, we aren't covering the whole alphabet, but instead there are key topics that do fit into some of these letters. So we're going to do a quick brainstorm. If you feel comfortable utilizing the chat, feel free to enter into the chat what you think some of the following letters would stand for. So we have A, B, C, E, F, K, M, O, S, N, P. Give that another moment in case anybody wanted to test their knowledge. Okay. So for A, we have A1C. B is blood pressure. C is cholesterol or cardiovascular health. E is for eyes. F is for feet. K is for kidneys. M is for medical team. O is for oral health. S is for smoking cessation. And V is for vaccinations. So get A is for A1C. An A1C test, also known as a hemoglobin A1C or HbA1c, is a blood test that measures your average blood sugar levels over a 3-month period. When sugar enters your bloodstream, it attaches hemoglobin, a protein in your red blood cells. Everyone has some sugar attached to their hemoglobin, but people with high blood sugar, they have more levels. You can see in the image in the top right an example of a red blood cell with the sugars attached. The A1C measures the percentage of your red blood cells that have sugar-coated hemoglobin. Red blood cells live for about 3 months. Nerve damage is one possible complication from having high blood sugar levels for a long time. High blood sugar damages your nerves, and these nerves may stop sending messages to different parts of your body. Nerve damage can cause health problems ranging from mild numbness to pain that makes it hard to do normal activities. And half of people with diabetes do have nerve damage. The good news is that you can help prevent or delay it by keeping your blood sugar as close to your target levels as possible. When you do this, you'll have more energy and you'll feel better. Your goal may vary, but most medical professionals will set a goal of an A1C of less than 7%. If you have diabetes, get an A1C test at least twice a year, more often if your medicine changes or if you have other health conditions, and talk to your doctor about how often is right for you. So good daily blood glucose control will mean an improved A1C over time. A1C is an important tool for managing diabetes, but it doesn't replace regular blood sugar testing at home. Blood sugar goes up and down throughout the day, throughout the night, which isn't captured by your A1C. The best way to manage your A1C and prevent complications is to maintain and manage your blood glucose levels or lower your blood glucose levels with lifestyle modifications. Being active or increasing your activity level. So this being physical activity, this makes your body more sensitive to insulin, which is that hormone that allows blood sugar to enter your cells for energy. It also helps to control blood sugar levels and lowers your cardiovascular risk. The general goal is 150 minutes per week, and make sure to check your blood sugar before being physically active, especially if you take insulin. If your blood sugar is too low and or too high, it is not recommended that you exercise. Check your glucose after to see how the activity impacts your glucose levels. Make sure to check that your feet or any injuries after an activity, and call your healthcare provider if you find an injury at all. Eating a balanced diet, so counting carbohydrates or carbs, which is the act of keeping track of carbs in all of your meals, snacks, drinks. This can help you match your activity level and your medicine to the food that you're eating. There's 3 types of carbs: sugars, such as the natural sugar in fruit and milk, or added sugar in soda and many other packaged foods. Starches, including wheat, oats, and other grains, starchy vegetables, such as corn and potatoes, and dried beans, lentils, and peas. Fiber, that's the part of the plant foods that isn't digested but helps you stay healthy. If you need support with carbohydrate counting, a certified diabetes educator or registered dietitian who has completed the CDE certification can help. We have staff at all of our medical centers who are available, and this service may be covered by certain insurances. Alcohol, especially combined with certain diabetes medications, can cause low blood sugar or hypoglycemia. Symptoms may include and mimic being drunk, such as slurred speech, drowsiness, confusion, or difficulty walking, which means you may not get help. And hypoglycemia can lead to seizures and even coma, and very rarely death. You'll want to avoid alcohol consumption, especially in excess. General limits are no more than 1 drink for females or 2 for males per day. All right, so our next letter, B, is for blood pressure. So what is blood pressure? It is the force of blood pushing against the walls of your arteries as your heart contracts and relaxes. That blood is carried from your heart to your body and then returned. It circulates and it's measured in 2 numbers. The number on the top is your systolic pressure, and that is the pressure when your heart is contracting and pushing the blood through your body. The bottom number is your diastolic pressure, and that is when the heart is at rest. You can see a small example in the photo on this page. Blood pressure rises and falls throughout the day and is individual to you. It can be impacted by activities, certain medications, and or caffeine, and more. It's important to know that high blood pressure is often a silent disease because there's often no symptoms. So as I said, your blood pressure is unique to you, and that means that so is your management. Blood pressure goals may vary depending on an individual's unique risks and any other health conditions that they may have. The general recommendation for those without diabetes is less than 120/80, and the goal for those living with diabetes is a blood pressure of 140/90 or less. If a person has other risk factors that put their heart health at risk, then that goal may be lower. The best way to reach that goal is, again, using lifestyle modifications, such as eating healthy and reducing your dietary sodium intake. That's a big one. The DASH diet is available online for a general recommendation. All right. Next letter, C, is for cholesterol, cardiovascular risk. If you have diabetes, you are twice as likely to have heart disease or a stroke than someone who doesn't have diabetes. Coronary artery disease is the most common type of heart or cardiovascular disease and is caused by the buildup of plaque in the walls of the coronary arteries, the blood vessels that supply oxygen and blood to the heart. A buildup of plaque and potentially a blockage in the vessels leading to the heart can result in a heart attack. If this blockage happens in the vessels leading to the brain, it can result in a stroke. In the vessels to the limbs, this can cause peripheral vascular disease as well. So for all of these reasons, it is important to have your cholesterol checked regularly and or as recommended by your care team. When you go to a healthcare professional, you'll want to get your cholesterol checked. This test, which is also called a lipid panel or a lipid profile, will usually check the levels of cholesterol and triglycerides in your body. Low density lipoprotein, you'll hear as LDL, sometimes called the bad cholesterol. This means having high levels of LDL cholesterol can lead to plaque buildup in your arteries, resulting in heart disease, like we just spoke about, and stroke as well. Think of the L as for lousy, so that people have a hard time sometimes differentiating between LDL and the HDL. Speaking of HDL, that is high density lipoprotein, and that is your good cholesterol. It's known as good cholesterol because high levels of it can lower your risk of heart disease and stroke. So think of H for happy or healthy, and again, L for lousy. Triglycerides are a type of fat in your blood that your body uses for energy. The combination of high levels of triglycerides with a low HDL cholesterol or high LDL cholesterol levels can increase your risk for heart attack and stroke. Your total cholesterol is the amount of cholesterol in your blood based on your HDL, LDL, and triglycerides. The best way to manage cholesterol, again, is using lifestyle modification, eating your balanced diet, primarily made up of lean proteins, fruit, vegetables, and whole grains. You should also limit processed foods because they often contact additional fats and sugars that you're going to want to aim to reduce. Also saturated fat and cholesterol intake, and you'll want to avoid trans fats as well. If you aren't exercising, start with slow and incorporate more physical activity into your daily routines. Again, aiming for that 150 minutes per week. If lifestyle modifications alone don't help, your medical team may recommend medication to help you improve those cholesterol levels. If medications are required or recommended due to no improvement after lifestyle modifications, the medication recommended will depend on your medical history and other risks. So our next letter is E, which is for eyes. Managing diabetes is important to protect your eye health. Diabetic retinopathy is common eye disease, which is the leading cause of blindness in working age adults. This condition is caused by high blood sugar, damaging blood vessels to the retina, and it usually affects both eyes. Damaged vessels can swell and leak, causing blurry vision or stopping the blood flow. There are a few diseases that can affect people with diabetes, and those include diabetic retinopathy, which we just mentioned, macular edema, cataracts, and glaucoma. You can protect your vision and lower your chance for vision loss with these steps. Get a dilated eye exam at least once a year so your eye doctor can spot any problems early when they're most treatable. Keep your blood sugar levels in your target range as much as possible. Over time, high blood sugar not only damages blood vessels in your eyes, it can also affect the shape of your lenses and make your vision blurry. Keep your blood sugar and cholesterol levels in your target range to lower your risk for eye diseases and vision loss. Also good for your health in general. Quit smoking. Quitting lowers your risk for diabetes, related eye diseases, and improves your health in many other ways. And again, get active. Physical activity protects your eyes and helps you manage diabetes. So F is for feet. Feet are an important and often taken for granted part of your body. And with diabetes, foot care is very important. Foot care for those with diabetes is important because diabetes is the #1 cause of non-traumatic lower extremity amputations. So to clarify, the types of amputations include traumatic, which are due to a major injury, such as an accident, but there's also non-traumatic, which are from planned surgery because of disease complications, such as diabetes. So as we mentioned in our previous slides, when the blood sugar glucose is high for a prolonged period, it can damage the vessels and nerves to the limbs, leading to peripheral artery disease, which can decrease sensation and cause a loss of sensation as well. And this can increase your risk of unintentional injury to your limbs. Nerve damage, along with poor blood flow, is another complication of diabetes. This puts you at risk for developing a foot ulcer or a sore or wound that could get infected and just not heal well. This can also apply to those with unintentional injuries to the feet as well. If an infection doesn't get better with treatment, your toe, foot, or part of your leg may need to be amputated in order to prevent the infection from spreading and to save your life. I say foot because often injuries on the feet are harder to spot, especially underneath the foot. The best way to manage your foot health is to achieve your blood sugar goals, get an annual foot exam with a clinician who will test your feet for sensation and look for any poorly healing injuries, as well as daily at-home visual monitoring. Caring for your feet is important because you most likely utilize your feet daily. You want to wash but not soak your feet, dry them carefully, especially between the toes, no lotion between toes. And you'll want to wear shoes or slippers with rubber or non-slip soles meaning no flip-flops, and socks make a breathable fabric as well. A good way for a person to do a foot self-inspection is to utilize a small mirror. We have one pictured here to see if there are any cuts, scrapes, or any other changes to the feet that you may notice. For those who may have difficulty cleaning the feet, a soft loofah on a long brush may be helpful when bathing. You'll see I noted that white is suggested. White socks are suggested because in the instance that someone has less sensation and accidentally injures the bottom of their foot, a white sock will show blood to let the person know that they need some care. Ask your podiatrist or medical team if you are okay to have a pedicure because of the soaking and the risk of accidental cuts. Those with diabetes will often need to have their toenails trimmed in their podiatrist's office to reduce the risk of unintentional injuries caused by cuts. Depending on your current health status, they can provide feedback and recommendations. For all people in general who get pedicures, make sure that any location uses new tools for each client and cleans between guests. And now we're at K, and K is for kidneys. Your kidneys help to remove waste products from the body, but over time, high blood sugar can damage the blood vessels that support your kidneys. High blood pressure can also damage the kidneys by straining those blood vessels. Chronic kidney disease, or CKD, occurs in 20 to 40% of people with diabetes, which is approximately 1 in 3 adults with diabetes. This condition takes a long time to develop and often has no signs or symptoms in the early stages, which means that those with it might not know without having a screening test. This brings me to our best prevention to keeping those kidneys healthy. Meet your glucose, A1C, and blood pressure goals, eating healthy diet, low in sodium, and being physically active. These are all ways to help with your kidney health. You should also get an annual screening. The annual screening typically involves a urine sample, and you'll want to talk with your medical team if you are unsure and if you need the screening. Which brings us to M for medical team. This letter is not typically listed in many, but I think it is important to stress that those with diabetes should be seen regularly by their medical care team. And depending on your unique needs and situation, that team may include some of the following: primary care physician, endocrinology, ophthalmologist for your eyes, podiatrist, a dentist, cardiology, nephrology, and a certified diabetes educator and/or registered dietitian. O is for oral health. Good oral health habits can help prevent pain and infections from tooth and gum disease. Gum disease can be more severe and take longer to heal if you have diabetes. If you have gum disease, your diabetes may be harder to manage. Here's a quick look at how diabetes can take its toll on your oral health. You may have less saliva, causing your mouth to feel dry. Dry mouth is also caused by certain medicines as well. Your gums may become inflamed and bleed often, again, signs of gum disease. Infections in your mouth may take longer to heal. The best way to care for your oral health when you have diabetes is to maintain your target blood glucose levels and your overall goal of oral hygiene, which we will discuss shortly. Dental visits are also recommended at least 2 times per year for professional cleaning and checkups. Treating gum disease may be helpful in lowering your blood sugars overall. So here are a few more important tips for keeping your mouth healthy. Brush your teeth at least twice a day with fluoride toothpaste. Flossing your teeth at least once a day. Telling your dentist if you have diabetes. If your gums are red, swollen, or bleed easily, see your dentist. These may be signs of gum disease. Other signs may include, again, dry mouth, loose teeth, or mouth pain. Again, see your dentist for regular dental visits. And if you smoke, quit. Smoking increases your risk of gum disease and can worsen your diabetes as well. Which brings us to S for smoking cessation. Smoking is a major cause of cardiovascular disease, and for those with diabetes, your risk for adverse health events increases. Smoking contributes to 1 in every 4 deaths from CVD. Smoking can narrow and irritate the lining of the blood vessels, damaging cells that line the blood vessels. It can also raise triglycerides and lower your good cholesterol, your HDL. It can make blood sticky and more likely to clot, which can block blood flow to the heart, which can lead to a heart attack and a stroke. It can also increase buildup of plaque, fat, cholesterol, calcium, and other substances as well. It causes thickening and narrowing of your blood vessels. If you currently smoke, there are resources to help you quit. Atlantic Health System has a free quit smoking program that includes an assessment, free nicotine replacement products while you're enrolled in a 6-week smoking group. There's also many options located in New Jersey and nationally as well. There's quit centers and the quit line, for example. We can provide you with a list of resources at the end of the program today. So now on to our final letter, V, which is for vaccinate. Diabetes, even if well managed, can make it harder for your immune system to fight infections. You may be at risk for more serious complications from an illness compared to people without diabetes. Adults need to keep their vaccinations up to date because immunity from childhood vaccines can wear off over time. You are also at risk for different diseases as an adult. Vaccination is one of the most convenient and safest preventative care measures available. Some illnesses like influenza can raise your blood glucose to dangerously high levels. People with diabetes have higher rates of hepatitis than the rest of the population. Outbreaks of hepatitis B associated with blood glucose monitoring procedures have happened among people with diabetes. People with diabetes are at an increased risk for death from pneumonia, lung infection, as well as blood infection and meningitis, which is an infection of the lining of the brain and spinal cord. Hepatitis B infection can cause liver disease and liver cancer. If over 50, the shingles vaccine is recommended. Tdap is recommended every 10 years as a booster. Pneumococcal is recommended for those 65 and older, or for those younger than 65 if they have certain high-risk conditions, such as asthma, heart, lung, or kidney disease, immunosuppressed, or lack a functional spleen, or are a smoker. COVID-19, there may be other vaccines recommended for you based on your lifestyle, your travel habits, and other factors as well. So in summary, diabetes can impact multiple systems from your head to your toes. Good maintenance and lifestyle behaviors can reduce those risks of complications or premature death. Knowing your numbers and remembering your ABCs, your glucose, A1C, blood pressure, cholesterol, etc. And it's important to go for regular care and recommended screenings. If you don't have a care team, start with your primary care practitioner. I'd like to include some information here on our services in the outpatient diabetes centers. We have a diabetes center located at each of our medical centers, and these centers offer medical care, diabetes education classes, and support groups.
Thank you, everyone. We appreciate you joining us today, and we kindly ask that you take a few minutes after today's webinar to complete the program survey. The link to the survey has been added to the chart for your convenience. A special thank you to Ashley for dedicating your time and expertise today. If you have any additional questions, you can send us an email to communityhealth@atlantichealth.org or call us at 1-844-472-8499, option 3. This concludes our webinar, and thank you, everyone.